Good morning, everyone. How are you going? David here from the Back Pain and Functional Movement Training Centre. Just a quick video before I forget, because often I do. I just saw a patient who had chronic and relapsing episodic low back pain, sort of about to sort of transition towards someone who we would say has chronic low back pain, persistent pain for 3 months or more. So that effectively means you've got bad days and worse days, no longer having good days, which kind of defines episodic back pain. So this person was normally quite athletic, having to reduce lifestyle activities because of the emerging chronic back pain. And they really had trouble understanding why they did not have a healthy back because of their physical athleticism. And I use this analogy, and it kind of, there was a bit of a light bulb moment. You could sort of see on their face, I go, oh, I get it. And the analogy that I used was, and hopefully you can use it as well, to help you explain a NeuroHAB, functional movement therapy, to your patients. As I said to her, that the primary pursuit that we strive for to help patients get a healthier lumbar spine is joint stability. Joint stability is absolutely essential for the health of every joint, stability. And I thought, let's use a real life example of stability, and a young child learning to ride their bike. When they first jump on their bike, they take their training wheels off and they're learning how to ride the bicycle. They are unstable, and the state of instability infers the susceptibility to injury. Okay, instability leads to injury. Stability prevents injury. And so for a child who's unstable riding a bike, Dad's sort of very close by, ready to catch little Johnny as he's about to fall because he's unstable. But as time goes on and little Johnny masters his bicycle, he becomes stable, and therefore he doesn't fall off his bike. And what is the factor? Everyone can think about this. What is the factor that allows little Johnny to become stable? It is not getting stronger in his core. It is not getting more stretchy in his ligaments and tendons and joint capsules. It is not through massaging his body. It is not through cortisone injections. It is not through surgery on his joints. It is not through taking pain medication. What is helping Johnny maintain or acquire stability is the neural control of coordinated muscle contraction that creates stability of his body on that bicycle, and therefore he prevents himself from getting injured. So stability is derived primarily from neural control of muscle contraction. And that is exactly what we are doing when we need stability of these joints. We need neural control of the intersegmental stabilizers, the general stabilizers, and the mobilizers to have a healthy joint. The mobilizers and the general stabilizers are more designed to create lumbar spine capacity. The intersegmental stabilizers, which are these guys here, the multifidus muscle, they are critically important for motion segment stability. No other muscle does that job primarily. So neural control is the key factor Just like little Johnny riding his bike, within a couple of weeks or even a few days, little Johnny has developed neural control. He hasn't got stronger. Of course he hasn't got stronger. He's still a young child learning to ride a bike. But he's developed better neural control, which has made him more stable. So stability is dependent on neural control. And that's what we need to do with our patients. We do not need to massage them. We do not need to strengthen their core. We do not need to just give them pain symptom remedies. We need to improve their neural control of multifidus activation. And how do we do that? We do that with functional movement therapy, which is neural control therapy. And the program is called NeuroHAB because it's rehabilitation of the nervous system, which is dictating neural coordination. Okay, that's it. That's the analogy. I hope that makes sense to you, and talk to you next time.